Hospice care. What to expect. Someone to hold your hand. Choosing Crossroads for your hospice care should help you feel a sense of relief. Our team is here to hold your hand through the process of getting the extra support you need to feel better right now. We're in this together. No one wants to admit that a life is ending, but the important thing to focus on is the extra comfort and support the hospice team will provide. Every end-of-life journey is unique. Some patients stay with us for many months, and some only a few hours. There are going to be good moments when you cherish your time and enjoy the calm. There will be hard moments too. Some people feel guilt, stress, or helplessness, which leads them to second-guess the decision to access hospice care. In any case, talk to us about it. We're always here to help. Remember to give us a call 24/7 at 855-327-4677. Over time, you will build relationships with our staff and get to know them and how much they care for their patients. What should you expect? The first day. The first day of hospice care is a busy one. The first visit can last between 2 to 4 hours to ensure you have everything you need. It begins with a non-invasive clinical assessment performed by a nurse. Orders for medication and equipment will be made based on this assessment. Like most important decisions, hospice also begins with a lot of paperwork. While lots of paperwork can feel overwhelming, you can take comfort in knowing that it is designed to protect you and ensure your wishes are being met. Our team is happy to go over each page to ensure you know exactly what you are signing. It is also important to know you can easily undo the paperwork if you choose to leave our program. It can be a lot for one day, but this flurry of activity gets you set up with all the items you need to be comfortable. Because hospice is fully covered under Medicare, Medicaid, and most insurances, there is no cost for the medication, equipment, and supplies that will be delivered to you. The first week. Settling into a new routine. Your hospice team supplements the care you are already receiving. The team consists of physicians, nurses, aides, chaplains, social workers, volunteers, and bereavement coordinators who all work together to care for you. They will each provide education on their role and on how to use the medications and supplies that you have been delivered. If you feel like this is too much, know that each team member of the team is coming on a schedule that is designed to meet your physical, emotional, and spiritual needs. You'll see some faces more than others. If you feel like it's too little, know that hospice is not designed to provide 24-hour care to patients. Your hospice team social worker can provide options for respite care or recommendations for home delivery services in your area, such as Meals on Wheels or others. Daily check-in calls. During the first 5 days, you can opt to receive a call from Crossroads between the hours of 4 p.m. to 8 p.m. This call ensures your needs are being met and provides you with the opportunity to ask any questions. Change is hard. When beginning hospice care, the team will do a full review of the care and medications you currently receive. They may recommend new medications to address unmanaged symptoms or discontinuing medications that are now unnecessary. It can be hard to say goodbye to past treatment plans, but each recommendation is made carefully based on our experience and our desire to ensure you are receiving the right care at the right time. When things get tough, there might come a time when your loved one's symptoms take a turn. You may feel the need to head to the emergency room, but now you have a team of people available 24 hours a day to answer your questions and address emergencies. We are your 911. On day 1, we provide an emergency kit of medication that can quickly get most emergent symptoms under control. If it's something the emergency kit can't address, we can dispatch someone to your home to provide hands-on care. We manage these situations at home, so you don't deal with the stress of an ER visit. If an ER visit is necessary, we'll direct you to one nearby where we can still care for you. As the journey progresses, as you move closer to the end, You will see more of our staff more frequently. In the final hours, we'll begin our Even More Care program and keep a member of our staff bedside through the final transition. We'll then support the family through the grieving process in the weeks and months ahead. Hospice is a service no one wants to need, but we'll all experience loss of a loved one at some point. Our staff will provide you with support, education, and a shoulder to cry on. You don't have to go through this alone.